So in today's video, we are going to talk about the various results that we may get specifically upon doing a PAP smear, also known as cervical smear. So I'm starting this series because the question of this type specifically appears when they come in USMLE exams. They are specifically very difficult to interpret. So I'll be starting this series in which I'll be discussing the specific findings which can occur as a result of that PAP smear, and what are the next guidelines, and in what age group what guidelines are recommended. So as you can see, like this topic specifically appears a lot in USMLE exams. Atypical squamous cells of undetermined significance. When a patient undergoes PAP smear or cervical smear, and we find out this ASC-US, which means atypical squamous cells of undetermined significance. So what should we do? So it typically depends upon the age. When the age is less than 25 years, what we need to do, we need to repeat the PAP smear every year for 2 consecutive years. Okay, so the guideline here says that we need to repeat PAP smear every year for 2 consecutive years, right? And if cytology is normal for 2 consecutive years, then we need to resume the age appropriate screening. In the age less than 25 years, we do not have to go for immediate colposcopy and biopsy. What we need to do, we need to test PAP smear every year for consecutive 2 years. This is basically the key info that will help you to help specifically in solving the questions. But then what are the recommendations for colposcopy in this age group? So the recommendations are, when we are doing 2 consecutive years, we are doing the repeat cytology, and if in any of this specifically time period we find out any sort of high grade squamous intraepithelial lesion, which is basically what, for example, that is the CIN 2 or 3, also known as high grade squamous intraepithelial lesion. If we found any of that, then what we need to do, then we immediately have to go for colposcopy and then immediately biopsy. So in the next video, I'll be discussing what we need to do in ASC-US findings in patients aged more than 25. So stay tuned.